Grand Rapids City Commission holds online meetings on April 14. Michigan Department of Health and Human Services launches a warm line to support Michiganders with mental health needs. And more statements from area organizations issued April 13, 2020, brought to you by the Rapidian. Kent County begins the week with 311 confirmed COVID-19 cases and 13 confirmed deaths. Michigan now has 25,635 confirmed cases and 1,602 confirmed deaths. These numbers reported by the state of Michigan as of April 13 at 3 p.m. The City of Grand Rapids announced on Monday, April 13, that the City Commission will hold its bi-monthly meetings online on Tuesday, April 14. The online meetings coincide with Governor Whitmer's extended stay home, stay safe order. And Tuesday's meetings will take place online through the video conferencing platform WebEx. The schedule follows: 8 a.m., Committee on Appointments; 8:30 a.m., Fiscal Committee; 9:15 a.m., Community Development Committee; 10 a.m., Committee of the Whole; 7 p.m., City Commission. The Committee of the Whole and City Commission meetings will broadcast live in English on Comcast Channel 26, Facebook, and YouTube. They will also broadcast live on the City of Grand Rapids Spanish language YouTube channel. More information about the online meetings is available on the City of Grand Rapids website, www.grcity.us. The Kent County Health Department announced Monday, April 13, the launch of a new website, Keep MI Healthy, for residents to take an anonymous and secure survey that will help healthcare professionals better understand how to fight the COVID-19 disease. With testing for COVID-19 still limited, difficulties have continued in understanding the current impact of the disease in Kent County and planning ahead for potential hospitalizations related to the disease. The website, created by the Kent County Health Department in partnership with other organizations, attempts to remedy that through the fast and simple survey for residents. The information the website collects is how many residents in one's household do or do not have symptoms related to COVID-19 and the zip code where these residents live. The website doesn't collect personal details or any other identifying information. Quote, "Hopefully we get enough people to participate so that we can begin to see, is the occurrence of these symptoms happening in a different way in the community? Are there surges in certain symptoms or reductions in the occurrences of certain symptoms happening in the community?" said Kent County Health Department Director Adam London. Hopefully, we have a sample of people willing to help us with that so that we can track those things and help to have one more tool in our toolbox to understand what's happening with the overall health of our community. More information about the survey is available on the Frequently Asked Questions page on the Keep Michigan Healthy website. And you can get there by going to www.keepmihealthy.org. The Michigan Department of Health and Human Services launched a statewide warm line on Monday, April 13, for Michiganders living with persistent mental health conditions during the COVID-19 pandemic. The warm line, or phone line, will connect residents with certified peer support specialists who have lived experiences of behavioral health issues, trauma, or personal crisis, and are trained to support and empower the callers. The warm line will operate 7 days a week from 10 a.m. until 2 a.m. at 1-888-733-7753. It's intended to serve residents living with persistent mental health challenges, including anxiety, depression, and trauma. Residents in crisis, including those considering suicide, are urged to contact the Disaster Distress Helpline, operating 24/7 at 1-800-985-5990, or the National Suicide Prevention Lifeline, also operating 24/7 at 1-800-273-8255. The Warm Line will help individuals with long-term mental health challenges find someone to talk to, someone who has lived these challenges themselves, and do it while staying safe and staying home, said Director Robert Gordon. COVID-19 is a grave threat not just to physical health, but also to mental health, and we are doing everything we can to offer support for everyone. Warm lines are an alternative to traditional psychiatric crisis hotlines and are used to avoid extreme emotional distress that can lead to hospitalization or other severe outcomes that are preventable with early intervention of peer support. Warm lines also aim to alleviate the burden on crisis responders by offering a solution for non-crisis callers. More information about the statewide Warm Line is available on the Michigan Department of Health and Human Services website at www.michigan.gov/MDHHS. Governor Gretchen Whitmer joined a coalition of 12 U.S. governors in sending a letter to the Trump administration officials on Monday, April 13, asking the administration to reconsider its decision not to open a special enrollment period for Affordable Care Act, ACA, or Obamacare, coverage during the pandemic. The Trump administration officials addressed in the letter are U.S. Department of Health and Human Services, Secretary Alex Azar, and Centers for Medicare and Medicaid Services Administrator Seema Verma. Too many of our constituents are uninsured or underinsured, despite the steps we've taken at the state level, the governor said in a joint statement. As a result, far too many of our residents are choosing to forego coronavirus testing and treatment out of fear of the potential costs to themselves and their families. It is essential that we remove every barrier as quickly as possible to ensure that those in our states and across the country are able to access the treatment they need. The coalition includes governors from Delaware, Illinois, Maine, Montana, New Jersey, New Mexico, North Carolina, Oregon, Pennsylvania, Virginia, Wisconsin, and now Michigan. One of the most effective ways this can be done is by opening up a federal special enrollment period to give everyone the chance to enroll in a health plan that offers the coverage they need with access to any qualifying subsidies, the governors continued. The Trump administration publicly decided against reopening ACA, or Obamacare enrollment, to uninsured Americans during the pandemic on Tuesday, March 31st. That same day, a White House official told Politico that, despite the administration's decision to forego a special enrollment period, the administration was exploring other options. More information about the governor's letter is available on Governor Whitmer's website, which you can find at www.michigan.gov/Whitmer. The Rapidian will continue to report on all major local developments related to the spread of COVID-19 and the community's prevention and response methods. Local residents are encouraged at this time to share your own stories and perspectives related to the COVID-19 situation on the Rapidian's platform, which can be found at www.therapidian.org. This message has been brought to you by the Rapidian, GRTV, and the Grand Rapids Community Media Center. Take care of yourselves and take care of each other. We'll see you soon.